Like we just heard from the First Nations Leadership Council and the BC First Nations Justice Council, and they're calling for an emergency cross-governmental and multilateral strategy that ensures the safety of people who use drugs. And Dr. Sayers, a BC FNJC council member, says the toxic drug crisis needs to be treated and addressed as a public health issue, not a criminal justice issue. And yes. Chief Grant Stewart also said it's very much wrapped in the destructive impacts of colonialism, right now, how we're proceeding. Can you maybe add to like your thoughts on those statements?
Yeah, I just want to emphasize the importance of safer supply, that's one tool that needs to be available to everybody. In addition to understanding the context of First Nations people, as I said earlier, we do not have community-based resources necessary to address the impacts of opioid toxicity or the toxic drug supply. We don't have services close to home where people need them when they need them. And that often leads them to, moving, traveling off reserve for periods of time. And often the crowd that they most find welcoming are crowds that are involved in selling illicit drugs. That comes back into community. And now we create a new relationship that has significant impact on families and on the whole community. For the first time ever, First Nations communities are reporting murders in their community, not by First Nations people murdering First Nations people. It's by gangs coming from large urban environments onto reserve and committing these crimes. Gun violence, human trafficking has increased. And if we look at, what is the perception of that? We could say, well, there are, because of racism in Canada, First Nations people will be blamed for those kinds of activities. They did this to themselves. But that's the same sentiment of people who use drugs. They should just stop. They can just decide. Why don't they choose something different when they're losing all these things? We're blaming the victim without supporting their right to health and social services. The United Nations, sorry.
Thank you, Dr. Hopkins. Ms. Goodrich, please.